And welcome. Tuesday, June 10, 2025. I'm Dr. Duke Majan. Our patient comes to us from Miami, Florida. Now, look here. You see that area right there? That's where he's had 2 prior back surgeries. 2. And he's still in horrible pain. He has horrible back pain. Came to Duke Spine Institute because he's tired of suffering and he's hoping we can fix him. His back pain is coming from the L34, L45 disc. And we're going to go ahead and get started. I'm going to give him a little numbing medicine. Now, this poor man has been suffering with pain for so long that has a hard time with the pain. He's so anxious. And it's just destroyed his personal life and is affecting his professional life. Sean? All right, so we could see L5S1, right, Jordan? We're going to go to L45 first. That's L45 right there where the arrow is. I'm going to get into the L45 disc shot. If you have questions, feel free to ask me. Meanwhile, Henry, if you could please share with the audience the 30 different causes of back pain, so we can better understand what this patient is experiencing. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L45, followed by L5S1, then L34. The L12 and L23 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majin. Thanks for joining us. And welcome back. From our video, you can see there are 30 very common causes of chronic back pain. This patient has 2. He also has facets, so he's got 4. He's got the L34, L45 disc, which we're fixing right now. Then he also has 2 facets on the right side, L34, L45. When patients injure their discs, they also injure their facet joints. And that doesn't mean everybody is going to have facet pain, but some patients do have facet pain. Now remember, he's had 2 prior surgeries. We got a Raytech on the floor, He's got 2 prior surgeries, which I did not do. Both of them were invasive microdiscectomy, laminectomy, and they both left the patient with horrific back pain. So we're here to fix his back pain. All right, there's the inside of the first disc. This is L45. Any questions from the audience? Henry?
At this moment, no current questions.
And this is a piece of herniation in my grabber that I'm taking out. This is the cause of the inflammation, and that inflammation is what causes his pain. Henry, let's show the audience how these disc injuries cause so much back pain.
Perfect.
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. We were just talking about the laser. This laser fiber that you're seeing at 12 o'clock on your screen is releasing laser energy from the tip of it. All right? So the laser energy that is delivered from the tip of this fiber, it originates in a machine. And that machine is about the size of a very, very large suitcase. It's on wheels. It's at the in the operating room. It's about 6 feet away from the tip of the fiber. And the laser machine has an operator, and the operator sets the settings on the laser with respect to the amount of joules and the frequency that the energy is released. And those are predetermined. We have specific settings for lumbar, specific settings for cervical and thoracic.
The AI name for that is Nikki.
Yeah, we have an AI program for that. Her name is Nikki. So, long story short, the energy that's being released here is actually generated from a machine, a medical laser called a Holmium YAG laser. And this laser that we use at Duke Spine is the best in the world. It's produced in Israel from a company called Luminous. And we use Luminous lasers. These are 100-watt lasers. Each machine now costs around $250,000, $250,000. And these machines are very special. And we use them in every one of our laser surgeries. Any questions from our audience?
At this moment, no current questions.
Now, have we shown the audience how we fix disc tears?
Yes, so how disc causes back pain, yes, we have, but
No,
not
how
how
we repair them with the laser.
Not yet, no.
Well, let's show the audience how we use the Duke Laser Disc Repair to eliminate this discogenic back pain.
Of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Yeah, we got drunk one night and drank out of the toilet bowls in the public restroom at the airport. No, I'm just kidding. All right, welcome back. We're just talking about my trip to Mexico last week and how wonderful it was. Any questions from our audience?
At this moment, no current questions.
All right, our patient is doing great. Dr. Berndez is just A+ effort over here, keeping the patient comfortable. He's laying comfortably asleep. Let's talk for a moment about anxiety and how anxiety and back pain can kind of work together against the patient and make the pain worse. So anxiety doesn't cause back pain. Anxiety doesn't cause any pain, but anxiety can make your pain worse. If you actually have pain and you allow yourself to get anxious, then your perception of the pain will be that it's far worse than it really is. You can start having shortness of breath. You can start having palpitations. So it's really important when you're having pain to try to do your best to stay calm and focus on just relaxing, even though it does hurt. Try some biofeedback. Try, if you have to, anti-inflammatories, muscle relaxers, usually pretty good temporarily. And then come to Duke Spine and let us fix your back so you don't have that pain anymore. That's what this patient's doing. He's here with his wife. They're both from Miami. He was a very active man. He had a very active lifestyle involving martial arts, jiu-jitsu, and he's had to put all that on the side because he's in so much pain. He went through 2 prior back surgeries. Both of them caused more pain than he was before he had surgery. That's because he had the wrong surgeries. He had microdiscectomies, laminectomies. Those types of surgeries do not fix back pain. They only make back pain worse. So here we are cleaning his herniation. And we're at 045, right, Luis? We're just about done with the left side at 045. You saw the video how the laser works. It gets rid of the painful tissue that causes back pain. That tissue lives right inside the back of the disc called the annulus, specifically in the annular tear. And you guys can see some fat tissue, some adipose tissue right there. The little bubbles are fat cells. And he's got a lot of inflammatory tissue right here, this red tissue. It's all due to inflammation. So we're going to get rid of some of this inflammatory tissue with the laser. Any questions from the audience?
At this moment, no current questions.
Once we clean this tear, he's going to be able to heal up very quickly, and the pain will never come back again. This is a permanent fix to back pain from a disc injury. Is that the needle on the other side? No. No, I think that's just calcified herniation. So I think we're okay. Any questions?
At this moment, no current questions.
All right, well, he's got facet pain as well. Let's show the audience what we do for facet joint pain.
Of course.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
I think we're gonna do some flagell, a little flagell. All right, welcome back. So we just got through playing our video on facet joint pain, which this patient has as well. We're going to be treating his facet pain per his request shortly. That's going to be after we're done with the laser surgery. Just about done cleaning up this first tear. I think he's going to do fantastic with this. Everything I see looks good. I'm very happy with his progress. And from an anesthesia standpoint, he's doing pretty darn good, right? Yeah. By the way, those are the fat cells we were talking about. There's a big glob of fat cells right there. That's what fat looks like. Every one of those little lights, the glistening lights, is another cell. So that's what fat cells look like. All right, any questions? We're done with the first disc.
At this moment, no current questions, but we did get a spike in viewership, so
Good.
hopefully more questions will come from that.
We were just watching in the room between the surgeries, we were watching scenes from a movie called Tropic Thunder. Yeah, most people like it. Oh, the interview? Wait a sec, I'm thinking of something else. Is that a good one? The interview? I think I remember. Came out a while ago, right? The interview?
It's a great, great movie.
Well, I do want to say we have Ariana, my daughter, here today. She's observing anesthesia and surgery. Welcome, Ariana. All right. The future of Duke Spine. Shot. Is that it there? Good. All right. Little pressure. I'm going to remove the needle over the guide wire. Remember, the guide wire guides. Its job is to guide the dilator down to the annular tear that we're going to repair, and to do it safely. That's the whole point. We want to do this safely. The dilator itself doesn't do any damage because it's got a tapered tip, meaning the tip of the dilator the tip of the dilator, you can see it on the x-ray there, Jordan will show it to you, is pointy, and it doesn't cut. It actually spreads apart fibers. So the only thing in your body that needs to be cut is your skin, because skin does not have fibers. Skin is a barrier, like a plastic sheet, keeping bacteria and fungus out and moisture in. But everything under your skin is fibrous. It has bands of fibers, like a shirt, cotton shirt. All right, we got a little movement. Just going to wait a minute, because this is the most painful part of the disc right here, is the annular tear. Any questions, Henry?
At this moment, no current questions.
So I'm going to finish the next disc, L3-4, left side. Then I'm going to move to the right side, L4-5. We'll be done with the disc surgery. And then we're going to come back for his facets. As a matter of fact, we might just do the facets straight after the disc without restreaming. I'll just move straight to the facets.
Copy that.
Shot. Take it. All right, looking good. Clearly the discs are painful because he was responding. Nothing else we did bothered him until I got to the tear in the back of the disc, and then he started wiggling around in pain. You guys see that? So we had to give him a little more sedation to put him down, make him comfortable. Any questions?
At this moment, no current questions.
Well, we show a nice testimonial from one of our past patients.
Of course.
I'm here with one of my post-op patients. We get a lot of requests for Dr. Duke. Can you show us a patient that had the surgery several weeks ago? Well, here's one. She had the Duke laser disc repair done at L3-4, L4-5. You were having back and leg symptoms before surgery. How are you doing today?
I have no pain today. I have no pain today. I suffered for such a long time. The leg pain was there for a good close to 3 years. I got to where I could hardly do anything. I'm normally an Energizer bunny. I'm always busy doing something all day long. It terribly curtailed my life. I couldn't hardly do anything without being in pain. And for a long time, I had to push through some just to do normal things, just to get me ready for the day. Now, it's gone.
Amen.
It's gone.
Now, you had your surgery done here at Duke Spine Institute in Florida in between two massive hurricanes, right?
Yes.
We had Milton recently, and before that we had Helene. And you had your surgeries smack in the middle of those two, between those two hurricanes.
Yes.
What brought you to Duke Spine Institute?
Well, my husband always trying to find something to help me. He did his research, and online we found you. So we came to see what you offered and what could be done. The other doctors wanted to fuse my back and L5 all the way to my tailbone, and I didn't want that. I was afraid of that. I had done decompression surgery at L3, 4, 4, 5. Within a few weeks after having that done, I was right back in the same pain.
We tell people about laminectomy. You had a laminectomy, it
Yes.
didn't work. I tell people avoid laminectomies. They're removing bones and ligaments out of the spine. It's very invasive, bloody, and damaging. But the laser surgery you had with us, we went in with a small, tiny Band-Aid incision.
Yes.
Outpatient, there was no bleeding.
And no pain from the surgery.
No pain from the surgery.
Wow.
Right?
I couldn't believe it. I'm like, you gave me a prescription for muscle relaxants, and I'm like, no pain surgery? I called to make sure. Are you sure? Because I don't I don't have a drawer full of pain pills because I don't believe in them, but I know I need them for surgery. I needed them when I had my decompression surgery. I needed them when I had emergency cervical surgery, and I had no pain, no surgical pain.
Yes, our procedure is so
Wow.
gentle that there's no surgical pain and you don't need to take painkillers.
No.
Amazing. Well, thank you for sharing your story with us. And you've been through so much, and you're in my prayers. I hope you do very well. Enjoy life.
Thank you. I so appreciate the prayers.
You're welcome. And welcome back. Hopefully you enjoyed hearing from one of our patients who had this exact surgery done for their back pain. We have lots of happy patients that come to Duke Spine for curing their back pain or neck pain. And I would say about 95% of our patients are very, very happy. They are completely pain-free. About 5% of them have some pain, but it's usually not coming from where we operate, it's coming from something we didn't operate on. And typically when we operate, the pain goes away completely. All right, this disc is far more recently injured. You can see there's a lot more disc material than the last one. The other disc at 045 was more degenerated. This one is a more recent injury, not as degenerated and collapsed, but still full of junk that needs to come out. Any questions?
At this moment, no current questions.
Folks, if you have a question, type it up and I'll answer it for you.
Please do.
We're going to do this disc, the next, then we're going to go on to the facets. We do have a permanent facet treatment. Other doctors don't have. It's called the Duke plasma rhizotomy. We use high energy electrons or plasma to destroy pain nerves to painful joints. It's permanent, unlike the RFA, which is temporary. You get permanent relief. All right, I'll just keep working until you guys think of something to ask. Ariana, you have any questions? So all those things that look like little feathers down there are pieces of torn disc and herniation. They should all be cleaned out as much as possible so that the disc can rebuild. If you were thinking about a war zone, those are all the destroyed buildings. You want to get rid of them, clean them out, so you can start rebuilding. Okay, the rebuilding is what the patient's body does. I don't rebuild the disc, the patient does. But I got to get rid of all these debris, this bad stuff, so that he can rebuild his disc. He will rebuild his disc once I clean all this stuff out. That's why we're helping his body do a natural process of rebuilding and repairing his own disc. That's what's beautiful about the surgery. We're not putting anything artificial in here. We're just cleaning up the debris so that he can heal his own disc. Make sense, Jan?
We have a question
Uh-huh.
coming from Charlie on YouTube,
Charlie, welcome.
asking, following either cervical or lumbar DLDR, what types of exercise is okay/not okay?
So, Charlie, once you give a year from your surgery for the DLDR, you can do anything you want. There's no restrictions on any exercise. So, all exercise is acceptable. It's only that first year of healing that you got to take it easy and avoid any kind of contact sports like football, rugby, soccer. I mean, anything where you can re-injure your spine. Skiing, you got to be careful with for about the first 9 months. And then after that, you can get back into doing any kind of exercising and sports you want. So the first 9 months, what I do is I'll sit down with my patients, I'll review what activities they want to do, and then I'll advise them on what they can and cannot do.
We have another question and or seeking advice coming from Maximus8992 on YouTube,
Hello Maximus, welcome to our stream at Duke Spine.
asking or commenting, I have had back pain. It got worse if I move in different ways, and I was waiting on a waiting list for a microdiscectomy, but was taken off. It was my last MRI showed the nerve was not getting impinged, but my pain still comes.
Yeah, you got exactly, your surgeon did the right thing. They took you off the list for microdiscectomy because they cannot fix back pain with microdiscectomy. We can. You need to come to Duke Spine, and this is exactly the procedure you need right here. Obviously, we have to figure out which discs are causing your back pain, but I assume it's either L4-5, L5-S1, or both. That's the most common cause of back pain, and we can fix it for you. So do the free MRI review. I will meet you on Zoom. I'll go over your MRI. I'll tell you exactly what needs to be done to fix your back pain. But microdiscectomy does not fix back pain, ever. Microdiscectomy is meant to unpinch a nerve that goes down your leg, and it causes leg pain or weakness in your leg, numbness in your leg. So your surgeon did you a favor by taking you off the list and not doing surgery. Many surgeons don't do that. They just do the surgery anyway and then expect you to come back and have a fusion. I hope you're somewhere near that you can come in and get your treatment at Duke Spine. All right, it doesn't look like it, but this is a very powerful laser, and the fiber you're looking at is 1 millimeter, 1 mm, 1 millimeter long or wide, not long but wide, and that little fiber of glass, it's optical quality. This is the same type of fiber that's used to transmit internet signals under the ocean and from place to place. This fiber transmits laser energy from a machine by the patient's feet that's in the operating room. $250,000 machine nowadays. It's how much a new one costs. And it transmits energy from that machine to the tip of this laser so that I can maneuver it to where I need it to go to remove this herniation and scar tissue. That's really what this surgery is all about. Precise control of a very destructive energy force that could potentially do great harm, but as long as the surgeon is properly trained and knows what they're doing, you can use that energy to help the patient recover. All right, there's a piece of herniation that just came up. We're just about finished here. I have another minute or two on this disc, and then I'm going to move on to the last disc, which is the right L4-5. But so far, he's doing really good. Dr. Berndes, I'm going to be moving over to right L4-5 in a moment, so he may be stimulated a little bit. All right?
Yeah, just checking. Recovery.
Everything okay?
Yeah, everything's good. I'm just getting
By the way, we do have one more patient after this. It's a cervical Duke laser disc repair. Sorry, cervical Duke plasma rhizotomy for facet pain. So the last patient has neck pain coming from her facet joints. We're going to treat her. That should be a pretty quick procedure. All right, I think we're just about done. We're outside the herniation, outside the disc. You can see the tear that was there. It was full of herniation before, We've gotten rid of it all. Now the disc will heal because the herniation is gone. I just got to get a little bit more right here. Any questions?
Yes, we have a question coming from Maximus once more on YouTube.
Yes, Maximus.
Saying thank you for your advice. Unfortunately, I live in Northern Ireland. I wish I was able to get your help. Sorry, I'm not. Do you think my back will always have pain, as there probably is no one like you where I live?
Well, my friend, let's hope that your back does not always have pain, but based on my 30 years of treating back pain, my concern and fear is that it will. And so maybe someday you can come visit us here in Florida. A lot of Americans go to Ireland to play golf. Maybe you can go the other way and come here to America to get your back fixed. Let's hope that's the case. There is nobody in Ireland that does what we do, unfortunately. I don't know if it helps you, but I am Irish. So if that helps, which I don't imagine it would, but maybe you can tell your government you're going to the States to have an Irish surgeon operate on you, huh?
That's some people from England, right?
Well, we have people from all over the world, so we accept it. We would accept him here, but he's saying he can't get here. So maybe he just can't afford to do it. I don't know. I wish we had a way to help these people. Maybe we can get Bill Gates to donate a few private jets and some pilots to fly people from around the world. You know, he wants to donate his hundreds of billions of dollars. Why not cure back pain worldwide? There's 1 billion people with back pain. Bill Gates could just donate a few private jets. Yeah, he said he's gonna. Well, he doesn't have to give it to us. He can give the money to the African company and they can pay for those people to come here and get fixed. You know, there's always ways to accommodate people's needs, even Bill Gates. Right, Nikki? Right. Nikki says she'll fly to Africa and help them get here. Huh? You'll go on a mission? Good. Maybe we can put an operating room in a jet and just fly the jet there and do the surgeries on the jet. Right?
As expensive.
That'd be kind of cool.
As expensive as that sounds, that actually sounds really cool. That sounds so much fun.
Yeah, air ambulance. One of my girlfriends in college, she worked for an air ambulance company in San Diego, and they would fly into Mexico, pick up Americans that were injured, you know, car accident stuff, and fly them back to hospitals in San Diego for surgery. Yeah.
We have a comment coming from Maximus saying, if you can get Bill Gates with a private jet, I will definitely get a seat on that. Thank you for your kind words. Thanks, Paul.
You're welcome. Listen, nothing makes me more angry than these billionaires that squander their billions and they don't help people that really need help. You know, they lie about it too. They all pretend to help people that need help. They all talk about donating their money to charities, but so many of those charities are nonsense, lying, cheating, stealing, thieving organizations designed to, whatever, enrich certain, you know, people. But I would love to see a true charity that's purpose is to help those who really do need the help, you know, and the money really gets there to help those people. We could do that here at Duke Spine because We're obviously helping people get out of pain. We just need money to help more people. If we had money, we could help more people.
I remember we weren't able to pick up any Mexican patriots with El Teresa because it cost too much jet depreciation.
Oh, shut up. You're so bad. You are funny, though. All right, any questions?
At this moment, no current questions.
All right, you guys are going to bore me to sleep without any questions here. We're working on our last disc now. This is the right L45 shot. Then we're going to hit up on the facets and fix those next. Remember, we're in the same disc on the other side, but now we're on the right side. So we've already fixed the left side. We're going to fix the right side. This is the time to ask questions if you've got them.
No current questions. So that if any come up, I'll let you know.
All right, so we're going to run right through this disc, and then we'll go to the facets without ending the broadcast, all right?
Not a problem. I'll
We'll
add a
change of plans.
perfect. I'll add chapters. Not a problem.
Ariana, you want to come stand here? Just watch out for the fluoro. No, you can stand right there. Perfect. Alrighty. You can see the inflammatory tissue once again. The red stuff shouldn't be there. That's what's causing all of his pain. Got to get rid of all this herniation here. How do we know this is herniation? Because it's blue. Only herniation will stain blue. There's nothing else that stains blue. Normally all of this stuff, even the herniation, is white. But when you put this special blue dye, it's called the Duke Spine dye, you put it in there, it actually binds to the nuclear material that's degenerated. And the way it knows it's degenerated is it's acidic. Acidic. Not Hasidic, but acidic. Right, Henry?
Correct. As I am Jewish.
It's not Jewish. It's just acidic.
Acidic, yeah.
All right.
But we do have a comment coming from Maximus once more on YouTube. Saying,
Maximus! I can't stop thinking about Gladiator when
Yeah,
I
I
hear
know,
the
they-
name Maximus.
that's exactly what I hear when I see that name.
By the way, before we take Maximus's comment,
Yep.
I mean, how many people saw Gladiator 2? No?
I did
You
not.
did? What did you think, Ariana? It's not as good as the first.
Exactly why I didn't see it.
Yeah, but all right, I saw it, and I am usually pretty critical of movies. I've got to say I really enjoyed Gladiator 2. I thought it was really, really good. I don't think it was as good as the first, but I still think it was damn good. It was worth seeing, okay?
I've been wanting to see it. It's just like,
It's good.
Okay.
You'll like it.
all right.
I'm telling you.
All right. I'll take
It's not as good. It's not as good. You can't beat Gladiator 1,
it. No.
but it is good enough to stay awake.
I saw when Ridley Scott's directing and Denzel's in it. It's
Denzel
sure it's-
Washington's in it. He does a really good job.
yeah. I'm sure it's good when you put those two together. But coming from Maximus once more on YouTube, saying, I totally agree with all your words. People do not realize how back pain can destroy your life. Don't forget to get me that seat on Bill Gates' plane reserved. Wish all the best for your patients.
Yes, thank you so much. We have no irrigation, guys. Who's watching the irrigation? Do we need to poke you over there? I need a cattle prod, please. Somebody get me one for Father's Day. I'm just kidding.
I already got you something.
Well, we're going to save you that seat, Maximus.
Oh, we got a comment coming from Janet on Facebook saying it is a shame that everyone needing your help can't get it. Just like Dr. Patrick Soon Shiong BioShield that cures cancer and prevents its return.
Well, thank you for your sentiment, and I partially agree with you, but not everyone that needs it can't get it, because this patient needs it, he's getting it. It's just that most people unfortunately can't afford it, and unfortunately performing surgery is very expensive. Even in the United States, it's ridiculously expensive. But fortunately some people can get it, and that's what keeps us going, is those people who support our company, believe in our product, believe in our work. They make an investment in their health. They come here and they get this surgery done. So we do have people that get it. We even have insurances that cover it. It's just, unfortunately, the insurances as a whole don't want to cover it, but we do have insurances that do cover it. For example, I think in 2 weeks we're having a patient whose insurance is covering the surgery. We had a patient 2 weeks ago whose insurance covered the surgery. So we do have insurances cover it, it's just not consistent. All right, I need about 2 more minutes on this disc. Then we're going to move to the facets and we'll be done. Look at that herniation that just popped out there. You guys see that? As soon as it popped out, I zapped it with a laser. Came right out of that crack right there. That is the annular tear. You guys see the tear right there? Right
Yes, we
there
do.
is the tear. You can see the torn fiber with the herniation stuck on it right here. That's what we have to remove to get rid of the pain. This is on the right side. This is his more painful side. Compared to the left side at L45, this side's a lot worse. It's got a lot more herniation on the right side at L45.
No current questions, but yep, we just got a few comments. This next comment is coming from Maximus, once more on YouTube, saying, "Now you know where I got my YouTube name from. Gladiator was a great film. Watched it so many times. The work you do to get people's lives back is amazing."
Thank you very much, Maximus. I appreciate you saying that. That means you understand what we're doing here at Duke Spine. Our core mission is to cure all back pain and neck pain in the world, which of course is not an easy thing to do because of access to care. You know, just a lot of people around the world just don't have the access. They don't have the ability, you know. They don't have the plane to fly here, the money to get here, the stay in a hotel, pay for the surgery. But I'm hoping someday we're going to have the ability to fix those people by maybe bringing these procedures to those countries that have people that can't get here, you know. Having Duke Spine Institutes in countries around the world so that people can just travel, like one in Europe, for example. And people from Europe could just go to that one in Europe, drive there. You know, Europe's not too big. Maybe you want to work at the one in Europe. Yeah, of course. And the person who's going to make that happen is standing right behind me. Her name is Ariana Duke-Majan, my daughter. She is here today, and she's very interested in carrying on our work that we started here at Duke Spine, my wife and I, son. She's going to work with her brother, the two of them, and their husbands and wives, and hopefully expand our service reach to other countries and people who can't make it here, and bring our technology to them. So, let's do a quick poll since we don't have any questions. Guys, gals who are here, where would you guys want to be stationed if you had a choice to work in a Duke Spine in any country in the world? Slow down, slow down. All right, Dr. Berndes, what did you say? Spain. All right. How about you, Nikki? Italy. You say Hawaii. All right. Luis. Where? Monaco. Wow, Luis, you don't hold back. Monaco. Dang. Well, that's the heart of the French Riviera, right? Monaco. It's a pretty happening place. Yeah. All right, so Luis will be at Monaco. Berndes would be in Spain. Me, I would probably be, I'm thinking right here or California. I'm not sure. I'd probably go back and forth between Florida and California. Like Northern California maybe, or Southern, San Diego. Huh? Yeah, of course. How about you, Ariana? Switzerland. Ah, we got one vote for Switzerland. Hi. How about you, Henry?
Either Nashville or New York.
So you're going to stay in America?
Yeah.
All right.
I'm a music guy, so Nashville, if I get to live there,
There you
I
go.
would.
Nikki, do we hear from you? You said Italy. So we got Italy, Monaco, Switzerland, Spain. Jordan, yeah, where's Jordan? Jordan, what are you saying? Germany? Where did you say Germany? Yeah, Germany. You said Palm Bay? Palm Bay. All right. Well, we've been talking about this for a long time, and I just signed the documents today to initiate the lawsuit against the first big insurance company in the United States for not covering the Duke laser disc repair for one of our patients who's willing to go up against the insurance companies. I can't give you his name, but it will be in the news. It may not be on prime time, but it will be in the news on some of the news channels. And the lawsuit will be filed most likely next month in July. And then we can talk a little more about it. I personally am not suing the insurance companies, but the patient whose surgery was denied will be suing. I saw the documents today. I signed the documents myself. So 16 years now I've been waiting to have this day in court, so to speak, to try to seek basically improve access to care. That's really what it comes down to. We want to give everybody the opportunity to have this surgery to cure their back pain if they want it. And I think there will be a lot of people who want it. So if we can just, Spine Scam, yeah. So we had the movie. Well, look at the inflammatory tissue right there. You guys see that? That reddish stuff there?
Yes, we do.
We had the movie down at Cannes in France, and it was shown around. We haven't sold it yet, but we're going to hopefully have it sold in the next 3 months. I fully expect it to be on Netflix. Let's put it that way. Now, it may not happen, but we're going to try. It's a really good movie. For those of you that have seen it, I think you agree it's an entertaining movie and it's informative. All right. This disc right here is probably the worst. This is L45. I thought we'd be done by now, but it's the never-ending herniation. This is pretty bad. Not only am I seeing the blue stuff, you guys see the blue herniation there?
Yes, we do.
Okay, but this red stuff is really bad inflammation. This is where his pain's really, if I had to pick one area, this is the right L45. This is the most pain is coming from this right here. That's what all that reddish brown tissue is. It's inflammatory tissue. There's absolutely no free fragments here. In a microdiscectomy, the surgeon would have stopped by now. There's no more pieces of large herniation. Everything is stuck down with scar tissue from chronic inflammation. This is where it gets really hard this is where the laser becomes very important, to release the rest of this stuff and get it out of here as much as I can. I'm having to get pretty aggressive with the scope.
We have a question and or seeking advice coming from Kit on YouTube.
Hi Kit, welcome back.
Saying, hello, Dr. Duke. I'm Kit from Las Vegas. Spoke with you many times. I really want to have bone fusion with you, and I really like your approach with TLIF and PLIF.
Yeah.
Sadly, my insurance is not covered to have fusion with you. All the orthopedic and neurosurgeons in Vegas only do ALIF. Could you please explain about ALIF, TLIF, and PLIF? And if I can't find any doctor to do TLIF or PLIF, should I do ALIF at L45, L5S1?
All right, so first of all, ALIF is anterior lumbar interbody fusion. It's the most dangerous of all the fusions. So why are your surgeons recommending it? Because they're probably orthopedic surgeon, spine surgeon. That's who you're seeing. And orthopedic surgeons are scared, for the most part, to go in the back of the spine and do a TLIF or PLIF. TLIF is the best. That's what I would recommend doing. If I do a fusion, I do a TLIF. It's the safest, and if it's done properly, it is the most effective treatment in the world for a discogenic problem, okay? Besides, if you can't do the Duke laser disc repair. So, TLIF. I would not do an ALIF. They're too dangerous. I would only do a TLIF. So, the ALIF, they go through your belly, and there's a bunch of nerves right in front of your spine there, and they can cut those nerves, and you're going to lose the ability to have an erection, and you're going to lose the ability to ejaculate sexually if they cut those nerves. So you have sexual dysfunction, okay? So it's bad. Also, the chance of injuring your intestines, cutting a hole in your intestine, causing you to have poop inside your belly and causing a massive infection called peritonitis, very high. Damaging a vein, like the iliac vein, very high. So damaging the ureter, which is how your kidney drains into your bladder, very high. Basically, complications through ALIF is the highest. That's the highest chance of complications. I would not recommend it. I would find a surgeon that does TLIF. There has to be TLIF surgeons. I'm sorry you're struggling, and yes, we don't have a contract for the fusion either. So you'd have to pay out of pocket a lot of money if you come to Duke Spine. We do have the very best treatment in the world, but we don't take very low payments from insurance companies because we'll go out of business. Sorry about that. Insurance companies, one way that they avoid people getting surgery is they underpay the hospital. They pay too little, so then the hospital or doctor can't afford to do the surgery. So then they got to say no to the patient, which makes the doctor look bad, but it's really the insurance company that's causing the problem. All right, we're just about done with this disc. I can't get any more herniation out of there. And you guys see the nerve root. I just saw it a minute ago. It was all red and swollen. Laser. Everything okay over there? You doing good?
Yeah.
We're not done yet. Give me about 1 minute. I'm just going to get this last bit here, and then we should be done. I want to look at the nerve root one more time because it's pretty cool. We don't get to see it very often. Yeah, but we cleaned this guy up pretty good. I'm pretty happy. This was definitely the worst area from what I'm seeing through the endoscope. And I think he's going to do really good once I just finish this little spot right here. Any other questions?
At this moment, no current questions.
This is all scar tissue right here from his prior microdiscectomy. This is where the microdiscectomy was. I can see it now. It's very obvious to me. This is from his prior surgery right here, this very particular type of scar tissue. It's very granular. And this is exactly where the pinched nerve is from his old surgery. They never really did a very good job of unpinching it. How much energy have we delivered? There's the nerve right there. You guys see it?
Yes, we do.
All right, I'm pretty happy with that. We're done. We're gonna finish up. That should heal up nicely. See how close we are to the nerve? We're just below it. So that nerve is what was getting irritated. There, it was really red. You guys see how red it was on the surface? Should be white, perfectly white, no red. Perfectly white is normal. Any redness is abnormal. That's inflammation. All right, any questions?
Yes, we have a question coming from Kit once more on YouTube,
All right, Kit.
asking, neurosurgeons in Vegas also recommended ALIF. Do you know someone that you can recommend for me in Las Vegas?
I do.
Oh, you have a spine surgeon you could recommend?
Yeah.
Sure.
Mark
Doc,
Havens.
Mark what?
Havens. K-A-B-I-N-S. Havens.
Mark Cabins, K-A-B-I-N-S. Dr. Berndes, our anesthesiologist, knows Dr. Cabins, K-A-B-I-N-S in Vegas, and said he's very good. So maybe look for a Dr. Cabins. Thanks, Dr. Berndes. All right, we finished the laser. We're going to move on to the plasma for the facets. That's next. Where is Ariana? All right. So everything went very well. I was happy. We're doing facets right 3, 4, 4, 5. Correct? All right, you guys see the facet joint?
Yes, we do.
Jordan's going to show you the facet joint. Right there is one of them. And right there is one of them. And then down below is one of them. Good. And then the bottom there should be one more. Yeah, that's 5, 1. And then 4, 5 above. And then 3, 4 there. You can see 2, 3 up there. All right, so I'm going to zap the pain nerve on 3 of these transverse processes, right where we are. Shot. Go ahead and put some right here. Put some num-num. Let me have a scalpel. We're going to get started. And let's show the audience, how is it that facet joints can be so painful?
Of course.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Come on up. It's going to be 2 minutes. All right. Take a look at the transverse process. Come on over. And you see the finger sticking out to the side of bone, the finger of bone? Okay, that's called the transverse process. The target is at the top half. top border, right exactly where Jordan is putting the arrow, right there. You see how the transverse process connects to the superior facet? Right where my probe is, that is exactly where we want to be. As a matter of fact, I just felt the probe cut the first pain nerve. He's moving a little bit, Dr. B. It's shot, it's affecting me. All right, see where the probe tip is? Show us the probe tip, Jordan. That little thing right there, that's exactly where the nerve wraps around and comes down and innervates the facet. Tell me when I can proceed. Shot. Literally where the tip of my probe is the perfect spot.
You put local on, right? Yes. Yes.
Well, that's just the skin. Okay, pressure. So we burned one pain nerve. We're going to go destroy a second one right now. See how the transverse process at this next level is abnormal? You guys see that? Henry?
Yes, we do.
Okay. Show us the abnormal transverse process. Shot? Yeah. It's not like the other ones that are nice and long. It's actually very weird. Zigzaggy. He was born that way. Shot? All right. Shot. All right, the tip is in the perfect spot for the second pain nerve to be destroyed. So I'm destroying that now. All right, we're going to go to the third. And we'll be done. Any questions?
At this moment, no current
Show us
questions.
the target for the last pain nerve, Jordan. You guys see that arrow right there? I'm going to put my tip right there, shot. All right, so I'm in exactly the perfect spot for destroying the third pain nerve. And that's it, we're done. Okay, that's the Duke plasma rhizotomy. It's the only permanent cure to facet pain in the world. It's the first discovered by me, and I patented it in the United States, and I have patents pending in Europe as well and other countries. But if you want to have permanent pain relief, you come to the Duke Spine Institute. We're the only ones in the world that offer the actual permanent pain relief treatments. Okay? A little pressure. All right, you guys see this? So we did the discs on both sides, and we did the facets with tiny little cuts to just a few millimeters each. That's why he's going to go home in about 30 minutes, and that pain that he had, that he came here with, is gone. All right. Great job, everyone. Thanks for joining us. We have one more quick surgery, which will take about 15 minutes, and that'll be the last one for today. We'll be back